Alright guys, as promised, we are recording the 5th episode of the Sazon and Spice podcast. My man, Sazon, that's what you're supposed to say hello.
And we're here today at Performax with our good friend Armand.
Yes, we are. We're here. We're both getting treated today. And you're going to learn that I have shit tolerance for pain. And we're going to see what Excel can do for pain, for his wrist.
Today you meet the Punisher, my friend.
And introducing, without further ado, the Punisher, Armand.
What's up, guys?
He's been practicing physical therapy for the past 15 years.
I wish it was 15, 20, my friend.
20 years.
I was lying to you about my age before.
Oh, okay, there you go. It's the gym that keeps you that young, huh?
That's right.
Okay, but let me ask you a question. So it's been about, what, 15, 20 years?
It's been coming up on 20.
Coming up on 20 years. What's been keeping you going for 20 years?
You know what, man? I got a passion for this stuff. I love helping people. I love helping the average Joe get to work in the morning. I love helping the athlete compete and perform better. I love the young kids, the old geriatrics. You learn a lot from them. It's really a great job.
So that's interesting. So you do got a wide variety of people walking through the door. Me knowing, because I'm one of the patients that do walk through these doors.
Correct.
As you guys will learn to know that there's a verb named after me called asading. But
not only will they learn about it, they will probably witness it.
They probably will.
That's
Do
the
your
goal,
thing.
that's the goal.
My goal is to not asad, but
You will, Assad.
He can't help himself. You really can't.
just do what you got to do. No,
Do you have something to bite today or no?
I don't. I actually do. I do. Actually, I have my girl's card test. I can just
Just give a
Bite onto the car keys. Well, we gotta make it home somehow.
call a tow truck. We need to get towed real quick. But so you've been doing this for about 20 years. You love helping people. But what's it? Are all injuries the same? Like talking about some of these injuries.
No, I mean there's a ton of different injuries. We see like total knee replacement, the post-surgicals from moms and dads working their asses off all their life, wearing their joints out. And, you know, we see them pre-exercise, pre-therapy stuff, and then we treat them after the surgery to get them back. And we treat NBA injuries, that could be a ACL tear, a pitching injury, like a rotator cuff, and even like gymnastics, they have a lot of shoulder issues, and each individual person's case is like so different.
Yeah.
You know, what may work on you doesn't work on him, and you know, even if you both have the same injury. So
Yeah.
it's kind of like a little puzzle each time they come in. It keeps it interesting.
That's what I find it to be really amazing in what you do. Just paying attention to the fact that not everything's the same, so you got to always be on your toes and maintain not so much just education, but it's something it's got to be natural in you and understanding what's happening.
I
What
do
you
believe
with each
that you
person.
have to have a gift of touch and awareness through your hands.
Gift of touch. This
Yeah.
guy's a funny guy. This
Pause,
man's touch.
pause.
Well, that requires a hard pause. His thumb gets deep in there. That requires, like I said, a hard pause.
Like the
Okay.
gift of touch. I do believe I've touched your soul. I think
You
said it.
touched. You went through my soul, sir. You have a place in my heart that I don't think any female could ever have.
Wow.
No, it's true. Wait,
I'm
don't
gonna
worry.
I'm going to tell your girl you said that.
Don't worry, she knows. She's seen me
She does
aside.
know. She's witnessed it. She was embarrassed. She was covering her head. As
She's like, I'm just gonna go wait in the car. I don't know
That's
who you are.
horrible. And mind you, this guy's loaded up with tattoos. and
What's
he's
worse,
like,
me or a tattoo?
Armand.
Armand.
There's not
You
even
know
a shadow of
what's
doubt.
funny is he was telling me, and we've talked about it multiple times throughout the podcast and the 4 episodes prior, and I was like, but at no point has he ever said, no, like if you've had a tattoo, like that's supposed to be really intense, no, this is worse. I'm just like, it can't be that bad. I'm thinking like, you know, when you go to like little Asian lady, she's like
Right.
goes too hard on your ankles and on your, you know, calves or whatever. It's like, that's got to be no. So now I'm like actually scared. but
Listen, man.
it's a whole different thing.
I got tattooed. I was getting tattooed by Bobby. I think it was. I got the outline of my chest done, and I put it up on Instagram. Armand's like, "How do you sit there? Don't even flinch." But when you're in here, I'm filming, I have music going on, I'm smiling,
Snapchat, all that
laughing,
stuff.
a needle's getting dragged through my skin, and you'd figure I would be like, no,
Yeah.
get up. No.
But it's different.
His thumb is way worse.
So what are we actually doing right now? One of the things I was going to say,
Right.
for some reason I've had, Philip, I'd say maybe the last 2 to 3 weeks, I've had this pain in my wrist, which comes with, like, if I pull my thumb back a little bit, it's like it runs through the side of my wrist, and you know, Armand set us up. You just want to be cool and get.
No, I'm just trying to show off my tattoos for Bobby. That's all it is. I'm just trying to be cool.
But he definitely, you know, right away wrapped up my wrist. And so what are we?
So what we got on there, we have the electric stimulation, which is kind of an anti-inflammatory treatment.
Okay.
It helps like calm the nerves down and take some of the irritation away. The heat on there, it's a moist heat. It's just to increase blood flow, get some flexibility going. Because we're going to manipulate that hand, my friend, and depending on what it is, by what you're saying, this could be uncomfortable.
Okay.
And
I'm actually excited because I've been trying to stretch it. I enjoy, you know, like I'll sit there and I'll rub through my thighs and stuff, trying to get the pain out.
Pause. What are you talking about, man? Where's this going?
Whenever I have, like, you know, just to stretch. Stop with the damn pause. No, but
you see that one rub my leg. Oh, yo, this is a long
overall, like,
podcast.
I'm actually looking forward to it because I'm the type of person, if whatever I go through to get better, that's what it is. And he's been telling me you guys are great at it, so I'm confident, you know, we'll figure it out.
That's my favorite type of patient. Just get it done.
Just get it done.
As long as it works, right?
I remember, funny story, I got my nose broken in a fight one night, and yeah, you know, it happens. And I remember just like sitting there in the car, nose bleeding, and my nose was crooked. And I was like, nah, I'm not gonna wake up tomorrow with a crooked nose. Right. And it's like, I'm in adrenaline mode right now, and I'm.
You cracked it back yourself?
Oh yeah, I was not waiting. I was like, I have friends that have that like monster, you know, crazy. Right. I was like, no, this is going away today.
You know what? You can get a lot done in adrenaline.
Yeah.
I dislocated my finger playing football. It was like turned like in my palm. And I went to my buddy on the field. I'm like, just pull it. He was like, and you know what? I just pulled it and put it back in. It didn't even hurt, you know.
At that moment, it allows for that
to
eliminate that pressure. How long have you guys been at this location?
This location, you know what? We have been here a whopping 4 days.
4 days.
This is the brand new location.
This is
beautiful
the brand new
location,
We
by
just
the
opened
way.
this spot, 150 Bayshore Road.
Yeah. Come through, and when you come through, say Sazon and Spice, and you'll definitely get a quicker appointment. I don't know about a
quicker
discount.
appointment. I know discount. We ain't
definitely just big quicker appointment.
Definitely a little extra paid too for knowing you two.
Oh, you don't know me. You know my man Sazon. You don't know me.
But Performax, actually, we formed in 2013, so we're coming up on 5 years.
Wow.
You know what's funny? First episode, I had their shirt on, recording.
Well,
I was trying to get the shirt, but I wore it to the gym already once.
I told them, I was like, why don't you have a shirt?
You know what it is?
Like, why aren't you wearing a shirt today?
I look for any excuse to go to the gym wearing Performax gear.
Yeah.
But that's just to promote my man so that people know that I come from the House of Pain. It shouldn't be called Performax.
Yeah.
It should definitely be called the House of Pain.
All right, so we're going to take these pads off.
Okay.
Let me steal this from you.
All right.
All right, so let's get a feel. So when you're feeling the pain, where is it?
Generally around this area, a little bit inside.
So make a girl's fist. That PC or not?
We're not PC on here.
Down like this.
We've talked about midgets on here.
Pain? Yeah. All right, so what you got there, believe it or not, is Decurvain's disease. Disease sounds scary, but it's just a tendonitis of your thumb tendon.
My man said disease. Like, yo, can I catch that?
Well, he's been rubbing his leg and doing God knows what with his hand. So feel that click? Don't put your head down. Embrace that.
Mm-hmm. Yeah. Okay.
Oh, there it is. That's what you needed. That little click. Did you feel that?
Yeah.
What happened? Did you jam it up or something?
I don't know.
My man also DJs. If you couldn't tell by his hat, he needs to remind himself what he does for a living.
Yeah, so that's pretty tight there, buddy.
Oh my God! So what are you doing there right now? So you walk us through what you're doing to him, because he looks like he's definitely not enjoying himself.
I'm loving it, actually. Like, it's painful, and I feel like as soon as he lets go, I feel like this relief.
So what's going on? Your thumb extensor tendon, the thumbs up tendon, runs from the tip of your thumb all the way up, turns into muscle, and attaches up here. So this muscle is tight too. So I can feel the tension in there. I'm just trying to break up some of that tension.
So while we're doing this, while you're going through this, while I was also looking up, you're associated with the Chamber of Commerce of Deer Park.
Yes.
Not only that, but you're also associated with Heads Up Concussion.
Mm-hmm.
How hard is it, or how tricky or difficult, for lack of better words, is it dealing with people who have gone through concussions?
Well, the scary thing is there's no real treatment for a concussion. It's more how you manage the symptoms. You know, what we really do here mainly is work on the musculoskeletal issues that come with that.
Okay.
You know, with concussion is usually some type of a whiplash because there was some type of head trauma and we work the muscles around it. But really what we do is we assess and clear kids to go back to sports.
Okay.
There's a certain protocol in New York State that you have to pass to return to play. It's
Okay.
called the return to play protocol. We're actually trying to do a pre-assessment so we have a baseline for
Okay.
these kids, because if you fall down and bang your head and you're having trouble doing some of the balance things, could be your balance sucks before the head injury. You know, we've had that problem. I couldn't clear a kid because he couldn't do some of the dynamic stuff. He just talking to the parents and he was like, well, he wasn't really ever good with balancing. So then I got in touch with the doctor and was like, listen, he's acing everything. He just can't stand on one leg for 20 seconds. Every time he fails. And I'm like, he's doing dynamic stuff with jumping, squatting, burpees, you know, simulated contact. He's passing the cognitive exam questions. So we do those pre-assessments too.
So you guys are associated with that, and you guys are also associated with ISA. For those that don't know, the ISSA.
Right.
What is? Speak a little bit about that, if you don't mind.
Well, that's me. I have the SPN certification,
Okay.
Sports Performance Nutritionist. I don't really do so much of that anymore, just because I've gotten so busy with just actually doing the manual treatments and physical therapy, and you know, we go to the summer run series, CrossFit events. You know, we're at gym events, so really my time has gotten smaller and smaller for things like that.
So you're spread out really right now.
Yeah.
'Cause, I mean, obviously you're growing.
We're
You guys
growing.
went from like the small location to this enormous facility. You know what I mean? Which is actually very beautiful. We will be showing you guys a tour of this facility, and we were going through the other parts of it. And what? Obviously, I know Rock Blade and the tape. For those that aren't really familiar but do see it around in their gyms and they do see it, can you speak to the people about rock blading
Sure.
and the taping, if you don't mind? Which you probably will see the blading later
You
on.
will
for me.
definitely see the blading, and it looks scary as hell.
It's really not that bad. It's not as bad as the thumbs.
No, the thumbs are way worse than the actual blade.
Uh-huh.
Trust me, if I were you right now, I'd ask for the blades at this point. Oh yeah, see that? A tattoo doesn't make you feel like that.
So I'll talk a little bit about the taping now, and I'll explain the blading
When you're blading me, perfect.
So what Rock Tape is? Rock Tape is a company, a movement company, which has really perfected the tape. You know, it's just kinesiology tape. That's the general what it was all called. Rock Tape is like the Mercedes-Benz of kinesiology tape.
Okay.
Pretty much, it sticks better, it stays on, which for it to work, it needs to remain on your skin.
It doesn't work for people like me because I'm hairy.
Because your hair will, yes. They do have, they started to sell Rock Tape for animals, so maybe
Animals,
it could work
yeah,
on
sure. Actually, with my 8-man t-shirt, I like that. I definitely want to be the test dummy for that.
And in general, right off the bat, the tape has 25% more tension.
Okay.
You know, if you use KT tape, it's stretchy, it's flimsy, it doesn't really get the job done. So Rock Tape is really the brand that is the best to use. Now, anybody can get certified in Rock Tape, believe it or not. There is a weekend certification. You could go, you could watch a YouTube video, you know, you could slap it on yourself.
But let me ask you a question, and this is going to sound like I'm throwing shade on that. How much of you being an actual physical therapist has it helped you with your knowledge with the course and being certified to do
I
the...
think what he was going to say was
And
anybody
that's how I was
could do
going.
it.
That's how I was going with it. Like, you know,
Yeah.
anybody could just throw the tape on. I get it. Even if you go through the certification, which I don't think is easy. Let's just call it, you know, because it is intricate.
I'll stop you there, but certification is easy.
I was just-
It's not that bad, to be honest. You know why it was easy? Because I have 20 years of physical therapy experience behind me.
Easy for you.
Right?
Not for me.
No, not for you. You really have to know the muscle fiber orientations, origin insertions. You need to know what's innervating, what's not. You have to really know the intricacies of the body, which I don't know why they don't require for taping or for rock blading, which is even scarier, if you ask me. Well, there's again, multiple certifications that you can get. There's different techniques. There's rock blading, there's hook grips, there's Graston. Graston's usually the one that's commonly known. And really, it's all just a different tool type, to be honest. Where Graston and hook grips, they have like 10 different tools. Rock blade has multi-angled tools, so you really only need 3.
Okay.
To be honest, I use 2 of them mainly.
You use the metal one and the black one.
The metal one and the black one. But have I used the Mohawk on you, my new metal one?
Yes.
That's my new favorite.
Yes, you have used the Mohawk on my lats.
That makes the biggest of men cry.
I don't doubt that. I highly do not doubt that at all.
I remember watching videos of these guys, him in Africa, and then just seeing them in pain. I don't know what you just did, but while you were in there, like it was hitting. I've been sitting in my office all week, just trying to hit the certain points and stretch this, and it's still there, but you were hitting right in exactly the place where the pain was.
Where your thumb articulates.
Yeah.
It was like really crunchy. It's a little crunchy now, but that first couple of pops set that joint. And when that's irritated, the tendon that runs over it gets inflamed because it's trying to protect it. So this isn't like a one-time cure. This is probably going to be sore later.
Yeah.
But in the next couple of days, you'll feel a release of tension and you'll be able to use it a little bit better.
What's crazy is it happened out of nowhere in the last couple of weeks, and I'm just like, oh, I'm feeling this, and it just started. It's not going away.
You know what? That's if you grab a gallon of milk, a gallon of water, pull the garbage out of the garbage can. That's a real functional.
Yeah, exactly.
Tendon. Forget if you're doing any type of biceps training, back, hammer curls. Forget about it.
Yeah.
You said
that's when I felt it. I felt it. I've been going to the gym, and I'm like, wait, what the heck is going on? Like, I haven't been able to do certain workouts just because I'm using both hands, and this one's not working out
right.
right.
The barbell causing
exactly.
it up there.
So definitely, one of the other things we were speaking about is we spoke about how being prepared or preparing yourself for even competition or just working out, doing certain things here at Performax will help people make sure to avoid injuries, things like what I might be going through or the injuries, which is what rock blading is an attempt at.
Right. The funny thing is a competitive athlete, they're on point on their food. They make sure that they get their sleep. They make sure that they train the proper amount. They drink enough water. But they really don't take care of the main issue, which is the muscles themselves, They're training hard, they're kicking their own ass, and they're building adhesions, limitations. The term muscle bound came because people didn't stretch. They built up all the adhesions, and then you lose flexibility. What we could do here, aside from just some of the heat and stretching and stuff that would really increase blood flow and get that mobility, the blading helps open up all that scar tissue, all that adhesions that binds the muscle, which allows the muscle to fire better. People beat their head into the wall trying to get their chest bigger. If your chest is all bound up with scar tissue and adhesions, keep on beating your head into the wall.
It's not going to get
In
bigger.
a couple of treatments, and I mean this, it sounds like BS, you will see a drastic difference. Your legs don't striate, let me blade your legs.
See,
2 times, let's see it.
My legs, they don't striate, so I know I need to, but we all know I can't sit for that.
We'll have to have him lay on you, hold you down.
He's probably going to have to. You saw how I was with my knee when I was having the knee issue.
Right.
But the one thing that I could attest to was, I remember after my first or second treatment, when you told me I look like I have douchebag shoulder.
That's a clinical term.
Okay. It's in the book like that.
No, I really do look like a douchebag, and I had douchebag shoulder. So I remember I messaged you a few weeks after my second and third session. I was like, yo, I can actually start lifting good quality weight. We're using the good quality, range of motion. When you told me instead of letting it touch your chest and being He-Man,
Right.
flex the muscle, let it stretch, and go right back up, which has helped me grow, and it's also helped me save my joints tremendously. Like,
Well, for what you were trying to do is more of a bodybuilding thing.
Yeah.
And really, a bodybuilding mentality shouldn't be move weight from point A to point B. It should use your pecs and the bench, contract the muscle, get as much feeling and contraction in. And just by opening it up, improving the range of motion, you're stimulating, instead of 75%, 90%, 100% of the muscles. So you can't help but grow.
Yeah.
As long as your food and everything else is on point.
What's crazy is I'm sitting here and I'm listening to Armand speak, and I feel like he can see my muscle physically, which I guarantee that's exactly what you can. Like, it's like your
on some Matrix vision.
Yeah,
it's
it's
crazy.
crazy.
Like your muscles, like
He's physically, like, while he was doing my wrist, he's like physically seeing exactly what he's touching, and that's amazing. And that only I think that's something you can't. You might learn it in a book, but after a certain time, you're like, no, that's just visually. Like, I know what's behind that. Like me working on cars, I know behind that bumper, there's this and this, and it's right there, just like, you know. So.
Well, you know what? You know how you know that? In school, one of the best classes, probably the one in my mind that, like you're saying, I go back to is that first gross anatomy, that first summer PT school, when they popped open that cadaver.
Oh gosh.
wait a second. Whoa.
How do you think I know what you look like underneath
I
that?
see that. See, that's just something people want to hurl. Hold on a second. So your first semester.
Of actual PT school, once I got into it. It was actually the summer session. It didn't even start the September. It was in like, June.
Whatever.
Graduated.
Yeah, I was looking at a dead body on the inside.
Yeah. Well, no. You go in and you go into your anatomy lab, and there's like eight tables with metal covers. And I heard from the older kids. Well, I'm old now, so everybody's.
At that time, they were older kids.
said that
They were the younger guys.
If the table doesn't close all the way at the top, don't go to that table. Because that was a fat person. And the reason why that sucks is you had to skin all that fat away. I mean, it was a dead body under there. It was a cadaver. You open it up,
Wait,
there he
so
is.
you guys weren't skinning, but taking the skin off.
Skin, fat, tattoos, take their tattoo, you know.
Wait, you were cutting them off?
It was like a dissection.
Don't make it sound like it's like.
No.
I gotta cut it off and then put it on my shoulder. How does it look? So there is respect for the dead. The guy goes, listen, anatomy lab. You're sitting there, you're looking at this person. Oh, it's not just a fake guy. You go, oh, this is Teddy. Teddy worked for Kodak for 30 years. Had lung cancer, died. He survived by a wife and 4 kids. Has 2 grandchildren. Trying to make this person real, and then they're like, all right, take his skin off.
No, you were like, that's what I'm saying, you were skinning these dead people. So to see the actual muscles underneath.
Yeah.
They made you guys cut the skin off the dead people.
Skin them.
I would have failed right then and there. I'm like, okay, this is cool. I'll be outside. Let me know who needs a ride home.
You want to know what some crazy stuff? So in anatomy lab, like they would, for the tests, they would like point out like a little string on a nerve. What nerve is this? What does it innervate? What does it do? You know, where does it come from? What's the brachial plexus nerve? Like all really technical stuff. But the guy was really a kind of a bastard. He would like take the left arm and put it on the right side of the body. He really, like you really had to know your stuff. So when you say I could completely visualize you, just your muscles, it's crazy.
So everybody
well,
has
I'm
PT
also.
School? I believe so.
I hope.
It should be, yeah.
I mean, that should be that. If you
know, when you talk about, I whaled my funny bone, I mean, I literally pulled the ulnar nerve out of the groove where your funny bone is, you know? Like, I saw it, I touched it.
Well, on the other note, with what you said, I also wonder, it's kind of like my friend, she's a dentist, so I'm always like, hey, how you doing? Right? So I feel the same thing. Like, you might look at my shoulders, they might be douchebag shoulders too.
Oh, well, they are, actually. I don't want to say.
See what I'm saying? It's like if my friend, she might be like...
Where are we looking over here? This is the one?
This is the camera one.
Here is douchebag shoulders. This.
Okay. They're sucked in.
Yeah, they're sucked in. You're lazy back here, you're tight up here.
Yeah.
So it's like this, bud, right? Ready?
Yeah.
Douchebag? Not a douchebag. It's as easy as that. So, look, you look so much better.
I'm working on it.
Okay, so what am I? I have asshole shoulder?
I've worked on you, so I think you're a recovered
getting better.
douchebag shoulder.
I'm a recovering douchebag.
You're in recovery.
Oh,
But clearly you like to lift heavy weights and do dumb shit, so that's why you're going to pop over on this table and we're going to demonstrate some blading.
See, I'm doing this for you guys, not for me. This is all for the views.
As we continue, this is part 1 of the Sazon and Spice. We're at Performax.
Performax.
That was very sexy.
Yeah, he was trying to get. You were getting in the mood.
That was Sazon.
Yeah, Spice don't talk like that.
And we're gonna set up here for part 2, and we'll give you guys some more information in just a little bit. Sazon and Spice.
Oh, we're back, and just to let you guys know that can't see what's going on, is I'm about to get my ass torn, pause, by Armand.
Yeah, big pause.
And he's working on my shoulder right now, and his magical thumb that's about to touch my soul. And he's going to be walking us through what goes on while he's working on my shoulder. As we just learned, he's cut open cadavers. Sick bastard.
So, I'm obviously not going to randomly rake a piece of metal off your body, across your body. That would be bad. So I'm feeling what we got going on here.
Oh!
Your biceps tendon's right under there. That's pretty tight. So as we know, your bicep is here, correct?
Yes, it is. You don't need to rub my bicep.
It's tense. See, now that has, you feel those little bumps? I'm going to start with blading with that. For this, I'm going to use the mullet, the Black Rock blade. It's a little bit more agile, light, better for me. And what I'm feeling underneath here is graininess, like so where, if you bring close, you may even be able to hear it. Just can you, hear that? You're not supposed to hear that. That's all the graininess. You took that.
I heard that, yeah, for real. It's like a tattoo, right?
No, this is fucking worse.
Oh, stop it. So we just released a little bit in there. Now that biceps tendon. Relax, relax. Do not assad.
This is called assading, for those that were wondering what. Oh, that's not it yet?
What the definition of assad is one, he always prefaces an assad by saying, do what you gotta do. I can take it. I'm a tattooed gorilla. I got lions on me. Do what you gotta do. And then I touch him gently. And then what do? Just show him for the camera. You don't like that. That's the assad. That's the classic.
That's the assad.
That's going to be the teaser to this, is what's the assad.
You never touch the therapist. So now we're trying to hit that front delt, pec insertion, a little bit of the side delt. If you pull that tank up over a bit, we'll cross over into the pec. Anybody who's ever had that done knows how well that feels. You train after doing that, you'll get the best pump. Open up that chest, it's amazing.
I'm going to be doing flies after this.
You know what I like to do, and this isn't something they really teach in class, but again, I do have 20 years of physical therapy experience. When you're working out, you're not just working out in this plane, right? So why would I just keep on blading in this same spot? I like to hit multi-angles, open up the muscle from different positions, so that you can hit your upper fibers, lower fibers, the medial fibers, you know. And that's something that's lost. I mean, that's where there's a technique to it. It's not just a 2-day course. It's 20 years.
20-year course.
Yeah.
And open up our bodies.
You know what? I'm learning every day because I see, like I said before, everybody's different.
Yeah.
Some people don't do well with this. I found different techniques, different blades. Like for the biceps tendon, I've learned that the mohawk.
Oh, is this like a demonstration of
I'm going to show a couple different things. You know, the mohawk is a little bit more point specific for something deeper like that biceps tendon. It's less of a sweeping move, it's more of a deeper.
He found a fucking tool that's like his thumb. Jesus Christ.
Now it's just a little bit worse, huh?
So you can see the surface area is a lot smaller. So that does hurt a little bit more, but it gets a little bit deeper. Some would say, to your soul.
Once again, this is what we promised you on Sazon and Spice. We definitely told you guys we were going to come to Performax and experience some
watching Rocky.
blading as we have Rocky
Always
playing right now.
He's watching Rocky. Oh, hey.
That's good.
I'm taking this a lot better than I thought.
He's probably taking it.
Camera's on.
He doesn't want to scare anybody on the camera either.
I don't know, nobody's going to want to come here if they see you. You should have had him on the table. He took it better than you.
I'm sure it probably is not the
good.
same.
Go to your side.
Oh, Jesus.
Whew.
The fun's over. The fun is the worst, guys. Like, don't...
How you feeling?
Yeah, I think I took that really good pause. You know what I'm saying?
You took the pain good?
Yeah, really good.
Now, oh Jesus! Now we're going to the mallet. The mallet has a nice curve to it, so it fits nicely on the delts. Keep that one by your side. And again, in there, I'm feeling all graininess. It's not smooth. That's just from all the abuse. You know, the shoulders take a beating, whether it be chest, tries, biceps. You know, hell, if you don't have good shoulder range much, you can't even squat. You know, and this is all tense in here.
Now, that graininess, after how long can somebody expect to not feel some of that graininess?
It usually takes a good 2 or 3 sessions, to be honest. You know, people think they want to get bladed for 40 minutes, a half hour, blade my whole body. You know, if you do it right, could you imagine if I did your whole body like this? You couldn't really take it.
No way.
And it releases so much toxins and breaks up so much stuff. It's really not even a good idea to do.
Got it.
You know, when we have people come here, I usually have people pick. We'll do your legs. I can hit your hams, quads, calves. Or we'll do your upper back. You know, upper back, lats. You know, tie-ins from rotator cuff and rear delts. Or I do chest, front delt, biceps. You know, it just really is too much. I mean, of recent with competitors, I've even done some obliques and some abs. Believe it or not.
You've done abs?
Yeah.
Do you guys work on, one of the things I have really tight hip flexors. Is that something that works out for?
Not so much for blading.
Okay.
That's more for the thumbs.
No, I'm good.
And that is really a lot of stretching because,
Yeah.
you know what, we kick our asses in the gym, and then when we're healing and recovering, we're usually sitting on the phone, sitting on the computer,
Exactly.
sitting eating, sitting driving, sitting at work. So everything heals flexed
Yeah.
as opposed to opened up. Hip flex is notoriously a problem.
Yeah.
Cause back problems. You know,
Well, that's what they told me.
we see it in young athletes. The kids today do not stretch. They train. They go home. They go on their computer.
They relax,
on their
hang
iPad.
out.
And I'll show you. We got a little room over there. I'll show you later that we start working out these young bucks. It's fun.
By the way, yeah, we will be doing a tour.
Where you going?
Those
Why are
of
you
us
on your
on the
back?
live session, we will be doing a tour and walking through Performax and making sure that we let you guys know what's all that's over here. Oh,
You're trying to make me jump out of here.
Trying to make you feel better.
feel better, damn it.
I hurt you because I care.
That's what he fucking says.
Isn't that the basis of an abusive relationship?
Yeah, I'm done. He wasn't
not
really
bad.
even laughing. You just caught the right point, right?
Oh, Jesus. Yeah, I'm done. I'm done.
He's tapping.
Fuck my shoulder.
Oh my
Who
God.
needs the shoulder?
There you go. Amenaside, or better known as Spice.
But look at that, though.
Couldn't
You
hang.
but you see that, though? All those blood vessels? That's how you know
pain.
really works. No, it's not even about pain. It's about opening everything up. In all fairness, I think I took this really well today for the
did.
camera. If the camera wasn't on, I'd be...
So I want
God
to
knows.
summarize what we did there. We used 3 tools and the best tools because the tool is only as good
As
as
the
the
operator.
person, you know, wielding it. And really, if I don't know what I'm doing, if I'm just randomly doing stuff, I could hurt somebody. So my touch is always first. I touch before I blade. I touch before I manipulate because you got to know what you're doing. You can't just do
Now,
it
how
randomly.
bad could this be if somebody was to like start doing this on their own? Like, you know how you see, not even with the course. You know how you always see some people that say, "Oh, you know, I have like a bad shoulder," and then you see them like at their desk. They'll take their thumb and they'll start digging into their shoulder. Like, how bad is that?
I mean, you could just keep on promoting the inflammation, to be honest. If you keep on inflaming, sometimes it'll get brittle and you can tear it. I mean, and I've seen people with reflex hammers, with butter knives trying to blade.
I've seen that when people try to blade themselves with butter knife. They'll take a knife and they'll start going like this. I'm like, dude, what are you doing?
And that, I mean, you could really do a lot of soft tissue damage.
Really?
You'll see some redness coming to the skin, some blood vessels. That's a sign that we're like releasing things.
Okay.
It shouldn't look like you got beaten by a bat, run over by a car, because some people do it like that, and that's just not the right way. It's not necessary. You know why? You know what that does? That promotes more adhesions, because that stuff has to heal.
Okay.
So it heals grainy. So what did you do? What you did, you secured yourself another visit next week. That's what you did.
Jesus.
But we're here doing it the right way.
My legs next week. You want to try doing that?
I would love to do that.
But we have to do when the place is closed. I'm not scaring people out of here.
Oh no, that's
prime time.
That's prime time.
That's going on the Performax Physical Therapy Instagram. And by the way, you can find Armand at Performax on their Instagram. Just make sure that you follow them, give them a like and a thumbs up. You know, they are locally owned, family owned. Whenever you come here, it's always family. And it's always nothing but love. And you know, Armand, I always appreciate all the love and all the sessions that I have, painful or not.
And it's at Performax PTW, by the way.
At Performax PTW. Make sure that's Performax PTW stands for Physical Therapy Wellness.
So Assad, this is really my crown jewel of this building. We have our own turf athletic area for dynamic activity. You can see over there we got agility ladders, we got medicine balls, Bosu balls, plyo boxes. What I'd really like to do is get like, some of the local teams in here.
Okay.
Do some agility training, sports specific and stuff. And, you know, we're big with bodybuilders. I don't know if you see over there. We see Kevin English, Vincenzo Massoni, Luis Crucia, you know, Jose Thirballetti, another pro. You know, I would love to have them come in here and maybe do some posing seminars. If you look around, we have mirrored walls, we have good lighting.
The lighting in here is definitely very nice. I can definitely.
And tell me about these mirrors. They're big mirrors, right?
They definitely make me look bigger than I am. I'm just saying, they definitely make me look a lot bigger than I am. But I like it. And you got like the full head to toe, so even if somebody's up here, you know, they can still see like their feet if they're having like a seminar up here.
Right, exactly.
And you can have at least like 5 to 12 competitors that want to learn how to pose right behind them. Yo, definitely.
That's what I'm hoping for.
Sazon, definitely get these mirrors in here. I need this in my bedroom.
You already know the mirrors and Spice. That's his thing. You can't give him a mirror. He tries to blow him up.
No, I'm serious. I'm not even joking. Like, you can definitely, you can get like a full range of motion. I love this. I think I would definitely take classes if you guys offer them here.
Well, we're looking into that. That's my dream for part of this room.
Do you have any people in mind that you're looking to get in here?
Well, I talked to Kevin English about possibly doing it. I talked to Jewel Fitness about possibly doing it. I mean, we're pretty well known in the industry, you know. We need to get the word out there. Maybe talk to Steve Weinberger, and, you know, see if he would give his blessing towards it. So
That'd be awesome. That'd be definitely, because you know what it is not. There's no places in Suffolk County, the east end of Long Island.
Right.
You have Nassau County with beds, and you have all those gyms out there in the city and stuff where people have all that. You'd be the first facility to have that over here. And I think it's that you have the great physical therapy setup, which is awesome. But when you have a room like this that caters to athletes and specifically, you know, also bodybuilders, I love that you have, because you also competed, right? Yes. Yeah. The one thing that we didn't bring up is that the fact that Armand has also competed. So you have a natural love for it, you understand the anatomy of the muscles of the body, and you also have appreciation for the sport, which I think sets you apart from everything else.
And I understand the struggle, the diet, the drain, and all that.
Last season, you should have seen my man. He was definitely getting pissed at every little thing. Can't have a beer, can't have a pizza.
A little angry.
But you know what? That's a sacrifice you pay, man. And you did do great. I always tell you, man. I'm your number one supporter, brother.
I appreciate that.
Guys, this wraps up episode number 5 of the Sazon and Spice podcast. Thank you, Armand, for letting us use your facility after hours. And guys, come down and check them out. Performax or PTW on Instagram. Come on in and definitely get treated by one of the best.